First thing you're going to notice is that a little bit of granulation tissue here that's kind of built up around this nail. So what we're looking at is that overgrowth of tissue that is being caused by this very deep ingrown nail. And don't worry, she's frozen. Can't feel a thing. This is our little tourniquet. So what we're going to do is free up this nail so that way it's not digging into the skin and this patient can get some pain relief. So you start by removing the nail from the nail bed. And you want to go back until you feel that little pop. And then you come back. Free up the edge. Perfect. The less trauma you can do to the nail bed, the better. You don't want to dig in too much. So now we go in and follow with the flat edge of our English anvil underneath the nail. And we follow it back right underneath where we were freeing up the nail. And this is the most important part. You want to make sure that it's nice and straight. One cut. And then we take our little beaver blade here. Sharp edge, you can kind of see. So it's rounded and sharp. And what we're going to do is follow this nail edge back into the nail matrix because it's still attached back there. So what I do is I guide it. You go in slow and straight. And you want to go back until you feel that nail complete the cut. And then I like to make sure that it's nice and freed. Still a little attached here, so what I'll do, give a little bit of a poke and just double check the margins. Let me take our hemostat right here. Grab the nail, lock it up, and then rotate it towards the midline. And then all that nail comes out as one clean sweep. So that is what was bothering our patient right there. So everything that the hemostat is covering, that is pinching, is what was visible. Everything that you're seeing was digging into the skin. So right there, or I'll give you, here. There we go. So all of this piece, this little strip here is where the nail was sitting. And this is nail polish, by the way, not blood. So you want to make sure that it's nice and clean. There's no pieces back there. I like to use a curette. It's a little razor sharp ice cream scooper. I like to go in there and check and see if there's any pieces of nail that might be lingering. So now we have to apply the chemical. So what I'm going to do is dry up the area. We don't want any blood because that'll make the chemical less effective. So we have the tourniquet on, but there's still going to be some capillary beds that are a little bit filled. So they're going to drain into our surgical site. So what I want to do is get that blood clean. So that way you have a nice bloodless field. Okay? And then we apply the chemical. This is phenol. It's an acid. So it's going to cause an acid burn to the matrix down here where the nail grows. So what ends up happening is we kill the matrix where the nail grows, and that prevents any nail from growing back into this area of skin that was causing the patient discomfort. So what I'm going to do now, remember we said there was some granulation tissue. I'm actually going to trim that because we don't want that affecting our healing site. What granulation tissue loves to do is bleed. So there's not much granulation tissue here, but you can see as I squeeze it, it does drain where I just made that cut from, because that granulation tissue is that healing tissue, but it was healing too much into and over that nail. So by trimming it, it allows that to kind of heal up a little bit nicer. And just make sure that we get the blood out and put a little bit more phenol on. So this is alcohol, isopropyl alcohol. It's just to neutralize the acid, so that way it doesn't continue to be activated once we send the patient home. So we're going to take off our tourniquet. And assess for any bleeding. So the first thing you're going to notice, that granulation tissue starts to discharge. Not much, but it's present, so we just need to make the patient aware of that. When this starts to heal, and when this heals over, it's going to look something like that. So this void will be filled, and you'll have a good cosmetic result, and nobody should really know the difference once it's healed over. So that's a good result. It's just antibiotic ointment. Some sterile non-adherent gauze, tube gauze. There you go. And this patient's ready to go home with some post-operative advice. Awesome, thank you.